Hi, welcome to Theirworld's International Women's Day Live. I'm delighted to be here. I'm the chair of Theirworld, and I've been campaigning for more than 20 years for the children to have the best start in life. And we're increasingly aware that the situation for the youngest members of society and the people that take care of them, the parents, the carers, the teaching assistants, and nursery teachers, is worsening and suffering from a lack of investment and interest at a global scale. So I'm joined live today by Professor Dame Lesley Regan, who's our first Women's Health Ambassador for England, Janet Mbugua, who's a Kenyan media personality and advocate for gender equality, and Sara Pascoe, a comedian, writer and actor, and parent to a 2-year-old who we may or may not hear from during this live. Now, I want to jump right into the conversation about early years. More than 40% of all children below primary school age, nearly 350 million of them, need childcare but don't get access to it. In countries like the US and UK, we're seeing women being forced to leave the workforce due to rising childcare costs. And in low and lower middle income countries, the need for childcare is more acute, with nearly 8 out of 10 children without access, leaving families at greater risks of cycles of poverty. So, of course, the lack of quality, affordable childcare is absolutely crucial. And early years plays that impact that we've got to provide that investment in those ages. So let's turn to all our contributors here. If I can start with you, Lesley, as one of the world's leading obstetricians, but somebody who's taken on the mantle of being Women's Health Ambassador, why does childcare matter, and how does that impact on women in their wider health and the economy too? Big question.
It is a big question, Sarah. Thank you for inviting me to contribute. And it's a very, very important question because you and I know that although we loved bringing up our children, that we also had other jobs that we wanted to make a contribution to. And I think I see every day, I see younger colleagues in my own world, in the world of medicine, who are finding it increasingly difficult to look after their children because of childcare costs. And if we just take that group, I mean, they leave or they go part-time or they just pull out of medicine completely. That's just one particular aspect of life. Think about all the other women who are leaving jobs, leaving the economy, and making their families less able to afford all the things that those children need. I mean, it's just such a crazy economic muddle if we can't actually arrange for women to have childcare for their children. And I think that there's, from my own experience of having twin daughters who are now 30 years old, I think they really benefited from their neglectful mother. I was always there in the holidays and to read them a story at night. But I think they benefited enormously from having people who were looking after them. And that was their job to do it. They didn't have to do the washing and the ironing and the shopping and the running around and this, that and the other. They just had the job of looking after them. And I think my children benefited from it greatly.
If I can turn to you, Janet, I know we're speaking to you when you're in Rwanda, but you're from Kenya. So you have that wider experience for East Africa. What do you experience on the ground there, and what are the challenges for women there with childcare?
I mean, the challenges are lovely, Sarah. First of all, thank you, and to all the incredible panelists. Unpaid care work, there's essentially an underserved community that affects a lot of the children there. So when you look at underserved areas like where my foundation is, in Wadada, which deals with menstrual equity, so sort of like a little bit further than the really younger children that we're talking about. But even then, you have women who need to go to work, right? There's not enough centers where these women can leave their children. And if they are there, they're not supervised, they're not gazetted. So we don't really know what level of care they're being given, but there's also not much of a choice or an option. And there's poverty that compounds this. If the centers are there, the staff are essentially underpaid or not paid at all. We don't even know the number of centers or daycare centers that exist. That number isn't there, that data isn't there. So what you're looking at is probably a massive growing issue that's really deprioritized and not looked at because there's other things and issues that we need to think about. But I think what that does is children aren't safe a lot of the time. A lot of them are not getting the right kind of start to their education because these centers are not being monitored or managed. And that begins to stifle their own journey in life. So unless there's resourcing, unless there's even some kind of monitoring, some kind of gazettement, and if we're able to create some kind of resourcing behind that, if we're able to make sure that there's enough of these centers that are able to host enough children, give them the right kind of nutrition and education. So that's what I interact with on the ground where I work, which is a little different from maybe the more served areas, where you still find, much like what has just been said, that we're lucky. We do have access to people who can help look after the children. But at the same time, the biggest issue for me is the lack of monitoring and standardization, which in many ways can then go back to affect these same children who are supposed to be looked after.
Thank you, Janet. Sara, I'm going to turn to you. You know, as a feminist writer and performer, you've dug quite deep in these issues in your books and in your shows. And even as a comedian, you've explored and unpicked what these barriers are. What do you see, particularly looking around the UK, as the biggest hurdles for us being able to go, do you know what, let's have decent childcare. Let's give women this support because it has a such bigger effect.
Well, I have to say, before I became a parent, I was very ignorant of this particular issue facing parents and the effect that it would have on women going back to work or feeling that they have choices in their life after having children. And I've really, so my son's 1, and we're just at that age we're looking for, somewhere for him to spend time a couple of days a week. And I was so shocked by how expensive it is. And then speaking to other women, it is women, as in like female friends, my friends who are back at work, they're affording childcare through, grandparents contributing, or they're just breaking even, but they're working not for more income for their family, but because otherwise their mental health would be so affected that they would feel like their life was, their career ambitions had just disappeared. And so it does feel like the subsidization of it, because there are fantastic facilities out there if you can afford them, and that feels so drastically unfair, because it should be for all children and all parents to have choices.
Now we're going to watch an interview with the actor, humanitarian and Save the Children India ambassador, Sanjana Sanghi. Sanjana couldn't join us live this evening, but I recorded a chat with her earlier this week.
I feel like, our own early years, which is the formative years of one's life, they shape you in ways that are far more fundamental and foundational than we realize for a long, long time. And I personally have been able to realize that because I think of the fact that I'm an actor, wherein for character building, I've had to dig back into my emotional reservoirs from childhood and ask many questions about why I am the way I am, or why I see the world the way I do. Um, and while I realized how potent those years are in terms of impact personally, I began to realize the same when I started working with the students that I work with, which is across India, across age groups and economic stratas. And when we sit together and talk about their dreams and their ambitions, and I realize how talented they are, the degree of intellectual capability that they have, how some of them are prolific in the arts, but when I see them today, there's the gap between their potential and where they are is so huge. And when we sit down and talk about it, we realize that it goes back to the very many drawbacks that their foundational years had. It was a non conducive environment. They weren't given a safe space in school to prosper, whether academically or otherwise. And even back home, there would either be domestic abuse or a serious struggle to meet the demands of one meal to the next, which prevents them from ever looking beyond. And so I think in this journey of working within education and hoping for a better world, the first starting point really should be to focus on those foundational years and making them the best that they can be for the largest number of children around the world.
just to finish off, I really want to kind of hone back in on our central question of whether women really are paying the cost of how we look after our early years. So whether we're including technology or including the chance to be able to meet with different people, what's that burden? What do we do about that burden of care, and how can we be more optimistic about what we can do in the future? Because as you say, that younger generation are approaching it differently and are being more thoughtful about how things are changing for them all.
You know, my because I think about this so much, from all the reading that one has done and the work that one has done, I have truly begun to feel that we are now finally at a place where I can say that we're two generations away from the woman not having to take the burden the way she is even today. And by two generations, I mean the generation in which, say, me being a millennial, I'm 26 years old when I become a mother, and then my children. But then after that will be when the woman will truly, I feel, have an equal footing, and I hope more than feel, in the world outside and in the world at home. Because right now the burden and the lingering effect of the inherently patriarchal society that we have all grown up in continues to exist, and technology has fastened the equalization, but it's not going to be able to immediately cover up. So it's going to take that much more time, but it's all about being on the right path and heading in the right direction, and that I think we are on. That is what I'm optimistic about. And I think that as world leaders put in their efforts to fasten the process, the dream would be that the generation right after me is able to see that equalization.
So Sanjana ends on quite an optimistic note and certainly puts her faith into a younger generation. Lesley, you get to walk into rooms and sit alongside government ministers and see that process of how they make decisions. You know, I'm passionate here talking about early childhood learning, but it's got to fit in alongside a bigger package with good nutrition and learning opportunities and play and socializing. And as you said, it's so important also as much for the mother's mental health as it is for those children. How do we create that bigger package, or how do we guide and advise leaders to create that bigger joined up package?
Well, I'm going to bring it back to the way we've designed our healthcare service, which isn't a healthcare service, it's a disease intervention service. Now, I'm a great Michael Marmot fan, so I know full well that the medicine I was trained to deliver only delivers a third of the solution, and the other two-thirds come from all the social determinants of disease. But in the bit that I can make a contribution to, when I'm sitting beside those government ministers, which I was today, I was saying, look, in a country that's got an economic crisis, we cannot afford not to give women good health and childcare and prevent disorders and prevent problems. And obviously, as you know, with my particular background in obstetrics and gynecology, I know that disadvantage starts before birth and that it accumulates through life. And you will know as well, Sarah, because we've talked about it on many occasions, we know, for example, that women who get postnatal depression have children who with a lower IQ, but that you can measure at the age of 5. Now, I'm not saying that's necessarily linked to childcare, but the environment in which women are not supported when they're doing things that no other human being can do, I think is really just, we know it's very negligent of us, let me put it that way. It's so easy, I think, to understand what's needed to keep women in the workplace, women fulfilled and their mental health in good shape as well, and also I think benefit the children. Because as I said, was referring to earlier, I think most children really benefit from being exposed to lots of other people in their early years. And one of the very, very striking things that I've seen during the COVID pandemic was some children who had never seen anyone in their lives apart from their immediate parents. And now that's a very extreme point, but I think that having the ability to go to childcare facilities or to meet up with other people is really important. You know, young people need stimulus. They really do need stimulus. And I take the point about safeguarding them, which is obviously very crucial too. And I'm not dismissing that, but I really do think that the stimulus side of things is absolutely crucial if they're going to grow up happy and fulfilled And you mentioned all the other things, Sarah. I keep saying to government ministers, the ones that will listen anyway, so why aren't we doing something about obesity? Why aren't we doing something about the appalling sort of food issues that we've got in this country? And I don't mean the food banks. I mean the fact that we've got such awful diets, and that, something like 40% of people now in this country are not just overweight, but they're moving towards obesity. And this is going to, it's going to really cripple us, isn't it?
Well, and there's more thinking about, we're seeing research coming out that's showing much of this happens in those very crucial early years.
Absolutely.
And we go back to that fact that gets recited over and over, that 90% of your brain is formed in those very crucial early years. And that's not that we can't change and develop later, but it does mean we should be putting our efforts in those early years to nourish and protect and allow our little people to develop.
Exactly.
Janet, let me come back to you with the thoughts that you were having about, squeezed resources in some of the areas that you could just see the big gaps there. You're an activist and you know how to mobilize for change. What is it that would make those leaders sit up and listen a bit more and decide to divert resources? Because I have a feeling that the people on the ground know what to do if the resources are coming to them.
I think sometimes it blows my mind that we're still fighting for these very basic, important issues to be prioritized. It actually blows my mind that we have to make a case for something that should be fairly obvious. I know I sound like a dreamer, but I've been doing this for about a decade, and whether it's around the broader issues that I tackle through the work I do, but as a mother and as an activist, there has to be a prioritization of the issue number one, because when you look at where the funding is allocated, I don't even think this kind of captures any element of the priority. It's seen as this is a them issue. They'll figure it out. Many others before them have. It'll be fine. But at the end of the day, it goes back to the points, that continue to be made on this session, which is we continue to deprioritize and wish away or find ways to work around it. And then we kind of come back and ask ourselves why we have a population that's struggling either with their mental health or with their education. It stems from the fact that they didn't have the kind of access that they deserved as children. And so I think, yes, activism, pushing for the prioritization of the issue, pushing for policy implementation, pushing for resourcing, to even go into the data and research about that, because I think we're even data thin, as a country, as a region. You find that a lot of other issues take precedence. And if it comes to children, we're looking at another, sort of like side issue that isn't to do with care. And I think care is even seen as something somewhat of a luxury. If we're talking about care work, or who's going to look after my children, or what's going to happen to my children when I go to work, the majority of Kenyans don't have the kind of access or privilege that some of us might have. That's the least of their worries. They need to get to work to find money to feed this child. Wherever they leave them, they just have to say, hope for the best, hope this is a center that I can come back and find my child. Workplaces in Nairobi have also begun to, one of the organizations a few years ago, they've started also integrating, this is now on the optimistic side, they started to integrate things like creches and spaces where mothers can come with their children. That's an exception, not the norm. But you find that this is one of the most productive companies in the region. So I'm like, it makes sense to be doing this. So why are we waiting for several other examples to show you that this is working? Because it does work. I have a friend who works for one of these organizations. She took maternity leave, was able to work from home for another few months, essentially 7 months out of the office because she wasn't being punished. And when she did go back, she was able to take her child. So I look at it from a two-pronged perspective. I look at it as we need to prioritize it and care enough. We need to resource it, and we need to integrate solutions because we're moving in a different direction. We're moving and evolving and realizing that this is integral to what's going to happen in the future. This isn't just something that you cross your fingers and hope my kids are going to be okay. And you wake up and they're 15 or 16 or 17 and they're feeling rejected, or they don't have the tools to learn. Right now, what we're trying to say is let's start it from really early, but let's put the kind of resourcing and data and research and capacity building that's going to allow these children to then thrive. So activism is going to need to take a much bolder approach. It's going to need to be a bit more specific on this issue. And I think I think we can move the needle somewhat because people are beginning to care, but the policymakers need to really care and prioritize it. We haven't seen that yet.
Well, I'm very mindful that the very people who need to speak up for themselves are pre-verbal at that stage or just learning. So we have to add voice to them. Sara, you talked about that frustration of having your eyes open in becoming a mum at the barriers that women and carers face to accessing childcare, leaning on grandparents, leaning on other families. That's as true in the UK as it is in Kenya, as it is in many other parts of the world where we rely on extended family or we rely on the resources that we've got. How do you think we make the case to say good childcare is affordable, accessible childcare is needed, if you just think of your personal experiences where you are? Sara frozen. Lesley, let me flip it across to you. I want to start talking a bit more about what it is we do and how we kind of add voice to it. You've got that top table, seat at the table perspective. If you were to think of campaigners or activists mobilizing, how do you think they'd be heard? Because the toddlers speaking up aren't going to be heard, so they're going to rely on all of us, and it's what penetrates through where we think we might create change, because this is something that's been going on for a long time.
Yes, and I mean, I think what we have to think, and I think you and I agree about this, Sara, whenever you're tackling a problem, you've got to work out where your barriers are going to come, and who are going to be your allies and who will be your foes. So I think one of the things that we should be doing in this country, for example, is thinking about the fact that one of the problems we have, as well as an economic crisis, and I realise these things are relative compared to the other countries that you're including on this webinar, but we do have an economic crisis, and we also have a workforce crisis in our health service. And surprise, surprise, the UK, or England now, is the largest employer of people in Europe. I suppose we're not in Europe anymore, but it's certainly a very, very large employer in this country. 77% of the NHS workforce are female, and the vast majority of them do have children or want to have children, and so many of them I see leaving the workplace because they can't afford childcare. I mean, I have midwifery colleagues at the moment who are going to food banks and are having to leave their midwifery posts, and we've had maternity crisis after maternity crisis. They can't do their job because they can't afford childcare. So I would say that we have to keep thinking about what are the things that matter to our political masters, and cost is obviously important, but I think somehow we've got to argue about childcare in the same way that I'm arguing for women's health. We actually have to put a sum of money down, or we have to invest in if we're going to be able to save money in the long term. And we know that in the healthcare world, prevention is infinitely cheaper than cure or treatment. And I think that we should also be trying to find ways of putting figures on the importance of giving women the ability to have safe and indeed excellent childcare, so that they can continue to contribute to their education or the workplace and to the economy widely. And as I said earlier, I mean, I think it's marvellous if women want to look after their children full time, but I think that I really do believe that that children really benefit from lots of outside stimuli and meeting lots of different people in their younger years. So I think that we should be saying to the government, look, if 77% of the national treasure, the NHS employees, are women, then let's first of all make this the best place in the world to be employed as a woman. And let's also make sure that you stay in your role and that we don't lose you because you can't afford childcare. Particularly important, of course, in cities where childcare tends to be even more expensive and housing costs are expensive.
So that's the message we've got to get in up at the top of governments for them to hear us.
Yep.
Sara, I wanted to ask you, you were talking about that struggle you see with other mums leaning on grandparents, trying to figure out how to make it work, spending all of their wages just to be able to afford that childcare. How do you think we can articulate exactly why it matters? Because if you've got one lot of money coming in and you're putting it out on childcare, what makes the case for that childcare being really important?
I guess this is why this is a communal effort, because just like you say that the toddlers can't speak for themselves and can't advocate for themselves, I think of a busy mother who's trying to balance work with young children, and we already know that they put everyone else's needs before their own. To then say to them, also, you could solve this problem if explain to the government a bit more about the studies about how the economy would benefit from you being able to go back to work full time when your child was 8 months old. I think going back to what Janet said, women are so good at coping, and they're so good at coping with difficult situations. And I think so many people think the struggle is just theirs. So maybe part of it is people knowing this isn't your problem to solve, but if we can all be really, really vocal, that there are countries who are dealing with this really well, subsidizing it properly, parents are happier, children are happier, and it's fairer because everyone, no matter what family they're born into, deserves certain things, as you say, in those very early years of brain development. That's what we want in a democracy.
Yeah, and so crucial. With your comedian hat on, how do you kind of unlock getting that interest? Because you have quite a big platform to get people interested. And I'm fascinated that you said you just hadn't been aware of it before becoming a mother of
Yeah.
yourself. What's that kind of, how do we reach those people like you before your little one arrived so that they too are on board?
Yeah. I think it is what was so interesting about your article today and the things that I've been reading sort of in preparation for this is really saying to people, whether you have children not now, other people in your life, other people in the workforce, other people that you're related to, or maybe you've got no investment in, I think it's one of those human rights issues for children actually and for parents. And always, this isn't about being nice to people. It's about what's better for our society in general. And so often those things slip off the table.
And it's so hard to make that point if you're trying to make a great big global point, whether it's to, a politician walking to run with a busy agenda or a mum who's trying to balance the budget for childcare. It's quite hard to make that big economic, world changing point all the time when for each of those
Yes.
two people about how they get through the day. Janet, I'll come back to you as an activist. I mean, you've mobilized campaigns for young women. You have the period equality campaigns that you run with your own foundation. You're working with young women who can also stand up and use their own voices. This time we've got to lean on busy mums and toddlers to make the case. And I wonder if that's sometimes why we've missed out here, is that you don't have a ready-made vocal crowd who can tweet and post and film stuff. How are we going to create that voice for the community that we're trying to serve, at the same time as trying to make that bigger case that this is, as we're all saying, for everyone?
I feel like in countries like Kenya, we kind of look at some issues as more urgent. I mean, that's probably everywhere. And what I'm trying to say is childcare is like a quiet cry that mothers probably just don't vocalize because you have to figure it out because it was figured out before. We are seeing a change. We're seeing more moms speaking up about it being a challenge. A lot of people, myself included, at some point I had to step back from work because I had mom guilt about my firstborn son. And much like what Sara has said, I didn't really have information or tools until my children came along and until I started to have to weigh the options of if I'm going to be anchoring the news at night and I'm not sure I have the kind of support that I hoped I would have, then what choice do I make? Again, it probably came from some kind of, privilege might be a big word, but I did have to step back because I didn't really know what else to do because you're not really given the tools to figure out, and you've got a workplace that's demanding your time, but you've also got a little baby and you genuinely feel like I want to be there for this child. That's one side of the voice. The other side is now the women that I mentioned earlier for whom they just need to figure out how to put food on the table. What happens to their children, it's not that it's a non-issue, it's just that I need to figure out how to make sure you're going to live another day, quite literally. So I think maybe what can happen is, and it's something that we love to do as an organization, something that I love to do, is encourage people to share their stories. I think when I think about how I got into my activism, it's because of stories of two girls who were 12 years old and didn't have access to menstrual equity and were using unsanitary products. And that shifted the conversation in the country because it was something that was mainstreamed and forced everyone to listen and watch. Girls were dropping out of school and missing out on an education, getting pregnant at a very young age, and therefore disrupting any future that they would possibly have. And that's exactly how we came into it. So listening to the stories, even of these mothers, I think is also something that we need to put front and center of this entire conversation. What are you dealing with? How do you think we can resolve this? If you had something that you could say to parliamentarians today about what you're dealing with and how you think we could make a difference in your life, in the life of your child, what would that be? Because they're the ones who essentially know what they need. They know what can happen. They know how best they can be met halfway. They don't necessarily have the technical speak. They don't have the data or research, but they have the lived experience. And I think a lot of us do. And so, yes, as you've asked, we have mobilized a lot of really huge campaigns around period equity. I think it's integrating that into the fact that a lot of the people we speak with anyway or help are mothers and trying to get them to see this as a priority issue. Because right now, the priority is survival, not necessarily even coming down to stimulation or care, it's survival. So how do we get them from surviving to thriving is, I think, what we need to try and figure out with them. But it also starts with getting mom to a place where she understands that she has agency over the issue. She understands that it's important that there is childcare, proper access to childcare for her child, getting the tools to even be able to have a good meal, for example. If we're able to kind of start there, I think integrating it into what the community is already doing just to get by, so to speak, then we can begin to make headway. But it's also creating that awareness to say, look, this matters as well. How can we get to a point where we're able to have healthier children with more access, given the circumstances that you're in?
Thank you. I think that point about giving people a sense of their own agency absolutely sums up what International Women's Day is about, is how we share what we know with other women so that we increasingly help them have that agency. So I'd like to say a big thank you to the three of you, to Lesley, to Janet and to Sara, for lending us their knowledge and expertise and energy on this topic. I know all of them have busy IWD agendas to get around and a baby to get to bed this evening. So what's clear, I think, from this conversation is that many people from different countries and walks of life are feeling that impact of the lack of investment in early years, and whether they have young children or not. But it still comes back to us to work out how to make that bigger case and how to, that this problem really is on a global scale. So I don't think we even get to tackle the big issues of our time, the equality issues, the climate change issues, the economic crises, without investing in our youngest people. So Theirworld is putting its energy behind an early years campaign this year. If you care about any of the issues being discussed today, go to www.theirworld.org/IWD and sign up. And starting from next month in April, we'll be launching a big global campaign and calling on you all to do something. So if you're signed up there, it might just be posting something on Instagram or liking someone else's post, but it will all add up and help. So thank you very much and happy International Women's Day.